Hello students, welcome back to my channel Samina's Telugu Pharmacology. In this video, I am going to explain you about anti-epileptics or also known as anticonvulsants, which are also known as anti-seizure medications. Let us know what is epilepsy first. This is a common neurological disorder of the brain which attacks 0.5 to 1 percentage of the world population, and this is characterized by recurrent seizures, and these recurrent seizures are often accompanied by unconsciousness or amnesia, which means loss of memory. You can see either unconsciousness or amnesia or both in case of epilepsy. First, we should know what are seizures. Seizures are nothing but a transient change in the behavior of the particular person for a very short period of time. Why? Because of disordered firing of certain group of brain neurons. Why do you see this disordered firing of group of brain neurons? It is due to the upregulation of excitatory neurons or due to the downregulation of inhibitory neurons. When you see the upregulation of excitatory neurons, the neurotransmitters like glutamate, which is an excitatory neurotransmitter, is released in high amounts, and the postsynaptic neuronal firing is abnormal, and the postsynaptic neuronal firing increases rather than the normal. Whereas in case of the down regulation of inhibitory neurons, the inhibitory neurotransmitter like GABA is released very slowly, which decreases the inhibitory signals. So due to these reasons, the seizures are seen, which is a transient alteration in the behavior. Okay, the seizures are mainly classified into two types: the focal onset seizures and the generalized seizures. Let us see what is focal onset seizures. The focal onset seizures are also known as partial seizures. They start in a certain area of a brain. They are confined only to the cortex region of the brain. Most of the epilepsies, that is 60% of the epilepsies, are of focal onset seizures. The focal onset seizures are further classified into three types. The first one is focal awareness seizures, also known as simple partial seizures. These type of seizures last for 60 seconds to 1 minute, 30 seconds to 1 minute, half to 1 minute, and the convulsions are confined only to a certain group of muscles, and this is only localized to certain area. Which area of cortex is involved in the seizures, only that area has this impact, and there is no loss of consciousness in case of focal awareness seizures. Now coming to the second type, focal impaired awareness seizures, also known as complex partial seizures. In this case, you can see confused behavior and purposeless movements in the patient. The purposeless movements are like hand wringing or lip smacking kind of movements, and you can see emotional changes in this case which last for 1 to 2 minutes, and you can also see impairment of consciousness, and this is often preceded by an aura. An aura is something which says that something big is going to happen with the patient, like loss of consciousness or numbness, or the patient may even experience visual disturbances too. The seizure focus is located in the temporal lobe of the brain. Coming to the third type of focal seizures, also known as partial seizures secondarily generalized. They are called partial seizures secondarily generalized because this initiates like a focal seizure and then transformed or evolves into a generalized tonic-clonic seizures, and here you can see the loss of consciousness in the patient. Let's see what is generalized seizures. Generalized seizures are those seizures which affect the whole brain, and the reason for these kind of seizures is of genetic origin, and these account for 40% of the epilepsies. So the generalized seizures are further classified into four types. The first one is absence seizures, which can also be called minor epilepsy, petit mal epilepsy. So these are prevalently seen in children, and this lasts about half minute, that is 30 seconds, and the children may lose consciousness for a moment. The patient apparently freezes and stares only in one direction. And the second type of generalized seizures are myoclonic seizures or shock-like momentary seizures. These are associated with the contraction of muscles, as the name indicates, myoclonic seizures. So contraction of muscles of a limb or the whole body for a certain time. The next type of seizures, that is generalized seizures, is atonic seizures, also known as akinetic epilepsy. Here, unconsciousness is seen due to the relaxation of the complete muscles. So here, excessive inhibitory discharges are seen and the patient may fall because the muscles are completely relaxed. Coming to the fourth type of generalized tonic-clonic seizures, also known as grand mal epilepsy. So this is the most common type of seizures, and these grand mal epilepsy or generalized tonic-clonic seizures last for about 1 to 2 minutes. The sequence for these seizures is aura, as I have explained you what is an aura in the previous slide, and this is followed by cry, then comes the unconsciousness and tonic spasm of all the body where the muscles become rigid, and then you can see clonic jerking like twitching in the whole body or at certain point, and this is followed by prolonged sleep, and here you can see complete depression of all CNS functions. In this picture you can clearly see and understand about the two types of seizures. Focal seizures, here you can see the healthy brain, this is the tears of the brain, and here you can see the focal seizures, which is only at a certain point of the brain or certain group of neurons are involved here. But in the generalized epilepsy or the generalized type of seizures, you can see that the seizures are completely spread all over the brain. So in the next video, we'll discuss about the classification of drugs along with a beautiful mnemonic and the mechanism of actions along with the adverse drug reactions of anti-epileptics. Thank you for watching this video. If you like the video, kindly subscribe, like, share and comment on my YouTube channel.